Welcome to the Health Tech Edge, the podcast on how technology is reshaping healthcare operations. I'm Mike Moore. Today's episode is a recap of HIMSS 2026. I want to keep this simple, not everything that happened, just what actually mattered. This year felt a little different at HIMSS. It wasn't really about whether healthcare should use AI. That debate is basically over. The real question now is where AI is working, what it's worth, and how to scale it without creating new problems. So here's how I'm going to break this down. Really, five things that stood out. First, that AI is moving from pilots to enterprise rollout. The market is splitting by maturity. ROI is now the admission ticket. Governance is becoming core infrastructure. And there's a deeper shift starting to show up. So if you're running operations, IT, or anything tied to cost and productivity in healthcare, this is where the signal is. So, a question to think about as you listen: where is your organization right now, honestly, and on what spectrum? All right, let's dive in for the first section here, talking about AI moving from pilots to enterprise. It's really the biggest shift. AI is moving out of that pilot experimental phase into broad enterprise adoption. There was a great example provided by Mass General Brigham. Their CIO talked about embedding AI across the organization, but doing it in a controlled way, not rushing, not trying to scale everything overnight. They've built what they call an AI zone. Think of it as a safe environment where staff can use approved models, even with protected data, but within clear guardrails. And that's the key point. It isn't just about tools anymore, it's about building the system around the tools. Security, governance, training, workflow integration, that's what the real adoption looks like. And honestly, that's where a lot of organizations are going to struggle. Not because they can't access AI, but because they don't have the structure to use it safely and consistently. So the takeaway here is simple. Healthcare isn't experimenting with AI anymore. Some organizations are starting to operationalize it. So if you tried to scale AI across your organization tomorrow, what would actually break first, the tech or the structure around it? Something to consider. Second thing that stood out is how uneven everything still is. There was a panel at HIMSS that described it as a very interesting time for AI maturity. That's a polite way of saying everyone is in a different place. Some organizations are still early, trying tools, running pilots, figuring out what's real. Others are spending money on things that look impressive but don't tie to outcomes. And then there are a few that are already seeing real impact. One example was a rural hospital using multiple AI algorithms in radiology. Leadership there said it's already helping save lives. That's a big gap. And you could feel that gap across the conference. Some conversations were still about what AI could do, others were about what it is already doing. So HIMSS wasn't one story, it was multiple timelines happening at once. And if you're a healthcare leader, that matters because the risk now isn't just moving too slow, it's also investing in the wrong things. So ask yourself, are you behind on AI or are you at risk of moving fast in the wrong direction? This brings us to the third point, ROI. This came up everywhere. At the executive summit, leaders talked about the pressure to show results, not just activity, not just innovation, results. And there's too much money going into technology right now for it to not produce something measurable. And you could see that in how vendors were talking too. Less about features, more about outcomes. Shorter cycle times, fewer denials, reduced administrative work, faster access, better utilization. Even the conversations around AI started to sound more like operations discussions, which is a good sign. Because healthcare doesn't need more tech for the sake of tech, it needs fewer people doing repetitive work, faster decisions, better throughput. So if there's one filter coming out of HIMSS, it's this. If you can't tie if you can't tie AI to measurable improvement, it's probably not going to last. If someone asked you today what your AI investments are actually delivering, could you answer that clearly in one sentence? The fourth theme is governance, and this is where things are getting more serious. At Mass General Brigham, the focus wasn't just on deploying AI, it was on responsible use. Privacy, security, compliance, workforce education, and more broadly at HIMSS, there was a lot of discussion about how governance and cybersecurity are starting to overlap, which makes sense. Every new AI tool introduces new risk, data exposure, model behavior, shadow AI use. So governance isn't just a compliance exercise anymore, it's becoming part of how organizations enable AI safety. And this is where a lot of teams underestimate the work because it's not about just picking a model. It's about deciding who can use it, where it can be used, what data it can access, how it's monitored, and how you prevent people from going around the system. That's real infrastructure. And without it, scaling AI gets messy fast. So, question to ask yourself: do you have a clear way to control and monitor how AI is being used today? Or are you assuming it's happening safely? Next, here's where the conversation gets more interesting. There was a question raised at HIMSS that I think is going to stick. At what point does it become unethical not to use AI? That's a very different framing. For the past couple of years, most of the discussion has been about the risks of AI, but there's another side to it. If AI can improve diagnoses, reduce delays, help clinicians make better decisions, what happens if you don't use it? At what point does that become a gap in care? John Halamka made a related point. Focus on the big problems: margins, burnout, staffing shortages, navigation. And his view was that AI augmented care may soon become part of the standard. Once something becomes standard, it's no longer optional. So we may be heading toward a shift where the question isn't, should we adopt AI? It's, how do we adopt it responsibly and quickly enough? In your organization, where would not using AI already feel like a missed opportunity for patients or staff? Before we wrap, there was one moment from HIMSS that cut through everything. It was the closing keynote from actor Jeremy Renner. He shared his experience from that near fatal accident that's been well publicized: multiple surgeries, long recovery. And he talked about this accident taking place on January 1st and becoming patient number one for the year. But really, it's his focus as being the center of that case and the needs that he had. He credited his first responders and clinicians for saving his life, of course, but he also pointed out something that should sound familiar: the lack of coordination. Different doctors across different facilities ordering the same tests, teams not communicating, data not flowing between care settings. At one point, he said he had around 8 doctors involved, all needing different information but not really connected. Even when the care is great, the system can feel fragmented. His message was simple: we need better data sharing, not as a technical goal, but to help clinicians do their jobs better. So ask yourself, if you were the patient moving through your own system, where would things break down? How can things be improved? And I think that's the right place to end this, because after all the AI conversations, all the demos, all the strategy, this is what it still comes back to. Can the system actually work together when it matters? So if I had to sum up HIMSS 2026, AI is moving into real workflows. Organizations are being pushed to prove value, governance is becoming part of the foundation, and interoperability still isn't solved. Jeremy Renner's story just made the last point real. Not abstract, real. And maybe that's the bigger takeaway. The technology is moving fast, but the real work of making the system work better for the people inside it, that's really the opportunity. So ask yourself one final question as we leave. What's one workflow in the organization that you can improve this year using AI and better data flow? And what's actually stopping you? That's it for today's episode. If you found this useful, share it with someone who's trying to make sense of where healthcare is actually heading. We'll see you next time on the Health Tech Edge.